I'm here with Stitch, and one of the benefits of K-Laser is it's well tolerated by cats. And the beauty about that is, more often than not, cats are much maligned in regards of treating them in regards of osteoarthritis. One of the only drugs that's actually licensed for cats with OA is meloxicam, but really long-term treatment of meloxicam is probably not ideal, and therefore if you can use this in combination, you can get a better overall effect on osteoarthritis, maybe in their elbows or in their lumbosacral area. Other aspects that cats can benefit is gingivitis, stomatitis, and a lot of people have great difficulty in keeping their cat's teeth clean. And inevitably there's infection, and they also can get some pretty nasty viruses. So being able to use it on the outside on that. And two other areas where it's really useful. So cats get quite a lot of feline asthma, and you can use it on the outside of their lung area or on their thoracic inlet. And with chronic renal disease, it's one of the biggest killers of cats. And therefore being able to do it around their actual abdominal upper area, covering that area to improve the perfusion but also reduce further inflammation and damage around their kidney is good. So if I put this on, you can see there's specific settings there for the cat here. And in the case of the difficulty here is you've got white and you've got some also grey areas. Now most of the area we're covering is going to be grey, so I'm going to choose the dark setting in this case. But if we were doing the lower limbs, we could use the white light setting. It depends on what part we're doing with Stitch. Okay. In regards to Stitch here, you've got again the incisions. You could do it post-surgery. You've got the dental, and you'd be able to use the laser around the actual area. And they find it often the cat will turn its head when it's got a bad gingivitis. So you may be treating one side, and it actually changes the head to the other side, which can be really rewarding, especially with the client inside in the room at the same time. In the case of this one though, you've got the wounds, which they often get cat bite wounds, and it's a good thing to use. You've got the musculoskeletal, but I'm going to do the bottom one there. And if I go to the next section here, you've got all these additional settings, okay? And when I get to the bottom there, you can see feline kidney. And so this is a specific setting. You need to do it both sides, but it's about a 4-minute setting. And if I just hold Stitch for a second, I can take this off. And I can have it round my shoulder just like that. And with Stitch sitting there nicely, if we turn that on there, and I've got it on full head setting there, you can see we can actually go and do that and just position it over Stitch's area where the kidney is. And in regards of being able to go and do that, Stitch usually goes and sits very nice, and he can just allow me to go and massage it over his kidney area. And there he can quite comfortably do it. It almost feels like he's having a massage, a hot massage. But actually we're just going and rubbing that deep into the skin surface and allowing it to go over the abdominal surface area. So it's penetrating down deep into his actual kidney area. And if it's a problem, we can just stop it at that point, and then we can restart it again. So if he is getting a little bit angsty, the good bit about it is we can do it. But you can see he's not feeling too stressed or anything. He's allowing me to do that. And then when we're finished, we can go and choose the other area there and just go over his other kidney area. And that will allow me to go and do that without too much problems in regards to how he's doing it. You can see he's rubbing his head against me there. He's a bit curious about everything because it's not usually done. But in general, the great thing about K-Laser in the cat, it's a non-invasive. And because of the warmth that it produces, they tend to go and tolerate it extremely well, especially in animals that might have quite a lot of pain from osteoarthritis. And in burying it deep into the coat there, you shouldn't go and cause too much absorption of the hair. But you are able to go and get right down to the areas of his soft tissues, which we're trying to go and get to. If we change that and we were doing his actual mouth, we could change the mouth setting, but again, we'd be able to go around his gums there, and we'd be able to go and choose to go around the different areas of his gingivitis. And the great thing is you don't need to actually open his mouth. One of the things clients would be worried about is near the eyes, but if you're doing it there and you're not shining directly into the eye, even in this case, we don't need to wear the goggles or the caggles in this case. So if you see these, some cats will tolerate having that, but the majority of cats wouldn't. So if you're worried about it, there really is, unless you're shining it directly into the eye, there should not be a problem, and you're able to go around the actual base of his mouth, and that will penetrate deep into his actual gingiva and into his surrounding stoma where he might have stomatitis. So it's a useful adjuvant along with some of the other aspects you can do for cats in regards of accelerated wounds, but also musculoskeletal side of things.